And an alternate way would be to come, and I'm just going to show you for a second with the transducers, to basically come and really come around more posterior to kind of catch the perineal in a heavier, deeper leg. So you'll follow these vessels down, again, recording velocity, recording color, looking along. Eventually, the perineal vessel, the deeper one here, will start to branch into a couple little branches, and you won't see it anymore. Basically, it has some communicating branches that will connect into portions of the distal anterior tib and posterior tib. So now I'm just going to focus a little bit on the posterior tib. Now, as I started earlier, I said, we don't want our color to look like this, so I'm going to drop my color gain back a whole bunch, okay, so we can get it out of the tissue, because we don't want it in the tissue. We want it in the blood vessel. So again, it's nice laminar flow, filling the vessel completely. We're coming down, and as you can see, I'm just about down to our subject's sock here. And if we were doing this, depending on the, I'm just going to take this down just a little bit. Depending on the reason why we were scanning a patient, we would include really following the vessel all the way down here to behind the ankle, as well as when we come around, we'll follow the dorsalis pedis on top. So we want to get all the way down to these pedal vessels, because it's those pedal vessels that may be an outflow source for some patients. So I'll just show you down here, when you Doppler or do a regular Doppler, where you're putting your transducer to listen for an ankle pressure. It's the same kind of thing that we're going to do here. Now, I didn't change the frequency of this transducer or anything. If it's a very skinny patient, these are very superficial vessels, and you might want to change the frequency. But we can see here on the ultrasound image a very nice, healthy posterior tibial artery. We're way distal. And a little bit further, we won't be calling this the posterior tib anymore. It'll become part of one of the plantar arches, and we'll take another Doppler way down here just to be complete. I'm just adjusting my scale a little bit so we can fit everything on the screen. I'm going to take the color off just for a second and just clean up that signal so I don't have any noise. And again, we still see a multiphasic pattern here. Our peak velocity of 73, end diastolic velocity is 0, and that's a normal pattern. So we've shown how to follow all the way down. The only other vessel we haven't evaluated is the anterior tibial artery. So I'm going to have you straighten your knee for me. And the anterior tib, I'm going to have you just roll it a little bit to the inside. That's fine. Is over here, okay? It's on the outside lateral compartment. Now, sometimes they're easy to find, and sometimes they're not as easy to find. So let's just take a gander here. I'm going to increase my depth again a little bit. And sometimes it's a little bit challenging to see what's what. All right, so what I like to do, and it's sort of cheating, but not really. You can follow these vessels any way you want. I'm going to come down to the foot, because right across the top of the ankle here, there's only one thing going on, and that one thing is the dorsalis pedis artery. The dorsalis pedis artery is the distal extension onto the foot of the anterior tibial artery. So here we have the dorsalis pedis, and we can see color. We can see it filling. It's a little vessel, 2 or 3 millimeters. Depends on the subject, obviously, but we should still see this kind of high resistance pattern. And we see that multiphasic pattern. So what we want to do here, you can do a couple things. You can follow it in grayscale, you can follow it in color. It's curving up around some of the ankle bones, and here we see coming back up. And we can see, even on color, I think you can appreciate This vessel is a little bit smaller than the posterior tib, but we're going to follow it back up. Here we are coming along. And we saw it where it took off, up off the popliteal, and now we're going to follow it right along the anterior compartment. And if you can appreciate, his tibia is about here, all right, the top edge of it. So we're just a couple of centimeters over. And if I take color off for a second and show you transverse where I am, okay, I'm just a little bit off of the side of the edge of the tibia here, and we're kind of deep, sort of sitting, you know, in between the two bones, but it's pretty easy. If you can't see it in the mid-calf region, follow it and evaluate it by finding the dorsalis pedis and coming backwards. And again, here's the color, nice and normal and filling all the way up. There's that Doppler. If we don't see that multiphasic Doppler, then we have to think either we're dealing with somebody who is in a hyperemic state, or perhaps they have an occlusion. It all depends on what's going on in this portion of the waveform. If we basically only see one systolic component, just this bit right here, and no reflected wave and no antegrade component at the end, we're probably dealing with a patient who we're upstream from an occlusion. It's experiencing pretty significant resistance. If we see this, but then we see a lot of diastolic flow, then now we know we're in a low resistance bed, and that could be the result of disease, or it could be a hyperemic state. But this is what we want to see pretty much in any artery outside arms, legs, so forth in a normal individual. So from here, we would follow and continue to follow on up, whatever mechanism is easiest for you. If you want to do color, because color certainly is kind of quick and not too difficult, we can follow it all the way back up in color. And again, you know, it's going to take a little tweaking here and there as the vessel changes shape. We might need to change, you know, our scale or color gain to keep it filling. And we might need to change our approach a little bit from a more lateral approach instead of a more anterior approach. And you'll see it's going to come up. What I'm going to have you do actually is just, can you roll just a little bit that way? Okay, I just want to be able to show you the very upper edge where the anterior tib dips away. And it's just a little easier here. So when we start over, we come back to where we were, where we knew we had the vessel, and come back on it. Of course, we got to get back on it. Just trying to figure out the best way to kind of approach it coming back up. We're getting a little artifact here. I think I was following it better in the other orientation, but here we see it. And again, we want to make it line right up so we know we're following the vessel. And we're kind of losing it a little bit up here. I'm just going to have you just relax your leg a little bit. Just relax like that. Okay. Because this really usually can follow this pretty easily up. So I'm not sure if it's just a little bit. Actually, we'll have you roll back over on your back. It was actually a little bit better to follow that from that approach. And I'm just gonna hold on here a little bit different. Okay. So again, we started down here because we can clearly see it on the ultrasound image as it crosses the ankle. All right. So we're going to come up where we found it last. All right. And this is just like real world. When you get lost, you come back to where you were and then continue to follow it. And again, I'm kind of over off to the side of the tibia. And here it's just a little bit easier view. I think as I turned him, some of the muscles got extended, some of the tendons a little bit, and it just sort of pushed things a little bit more out of view. Now we should be able to come up and follow it. We're still losing it a little bit here, so I'm going to see what I can follow it more in transverse. Now he might have a little bit, his anatomy might be such, we're getting a little bit of artifact right here, okay? And we're losing it a little bit here. But some folks, you know, you can follow it up pretty far, and others, you don't get to follow it quite so far. The important part, though, we saw the takeoff of the anterior tib. I'm just following it here transversely. And we're coming up, it's getting a little deeper. But again, we had a nice normal waveform. We're getting a little bit up here now. Okay, and in a minute, not much further, it's going to take a nosedive and go away from us. Let's put our color on here for a sec. And I'm coming up, I'm still coming. And now we can see, where is it going? It's dipping away from us right here, okay? As you can see where my hand is, it's coming up. It's going to go behind the tibia through an opening in the interosseous membrane and hook back up to the popliteal. So we've got a nice, and there's the companion veins alongside as I move here and there, but we should still see that nice multiphasic pattern. And that's exactly what we're getting. Okay, so basically we could follow it further than I thought, but again, about at this point, it's going to dip down and go away from us. So, to recap, we've taken you through the lower extremity arterial duplex. We started up here at the common femoral artery. And as I said, if that's all nice and normal, we're good here. If it's not, then we'd want to go further north and look at the iliacs and even the aorta. But that's not routinely done in some labs. Some labs do the whole thing. That's a matter of your preference. Up at the top, we looked at the common fem and the origin of the profunda femoral or deep femoral artery. We scanned through the whole length of the superficial femoral artery. Then we kind of came from behind the knee like this, and we evaluated the popliteal, the takeoff of the anterior tib, the tibial perineal trunk, and then from a more posterior medial approach in through here, we followed the posterior tibial and perineal arteries down, following the posterior tibial artery behind the ankle. And then just to wrap it up, we found the dorsalis pedis at the top of the foot and followed it back as it became the anterior tib and continued all the way up to about here where it dove down away from us to come back up into the popliteal. We looked at color, we looked at the grayscale, and we looked at Doppler, and we recorded everything, and that is the lower extremity arterial duplex scan.